The County Seat is brought to you this week by Jones and DeMille Engineering, helping to shape your quality of life. Find out more at jonesanddemille.com. Hello, everybody. Welcome to the County Seat. I'm your host, Chad Booth. Today we are talking about emergency medical services. Now, this has been a topic that has become a very hot topic in rural Utah just because of the sheer shortages of available people and the way the mechanism works. There have been a lot of discussions on how to possibly approach this, but it now is starting to take attention within the legislature, and we're going to start by doing a review of a bill that Representative Johnson has put forth. Here's Derek Dowsett with that report.
911, what's the address of your emergency?
When you have a medical emergency and call 911, the expectation is an ambulance will show up quickly. Now, in most cases, an ambulance is on its way, but when it will arrive, well, that depends on where you are in the state. We often forget just how many miles there are between some communities and the nearest hospital. And that's the challenge for EMS teams around the state. The problem they face is that emergency medical services are not considered an essential service in Utah.
The 11-7 code in the state code requires municipalities to have fire protection, but EMS is not under that same mandate. Every area within the state of Utah is covered by a transport service, right? An ambulance service to some level. But that's interesting because it's mandated that it's covered. So there's a provider, but it doesn't stipulate what that service level would be like. There's guarantee that one will come, but there's no time constraint on what that will look like.
I became aware of the fact that this issue existed when I asked the question to Chief Brad Hannock, Chief, what can I do for you? And he started explaining to me this issue, and I was like, really? Because I thought this was an essential service too. I didn't know any better. And so it was through that investigation on my own, I started learning things, and I thought, you know what, I need to do something about this.
It was that revelation that inspired Representative Johnson to sponsor legislation this year that would certify EMS in Utah as an essential service that local governments must provide in addition to fire and police.
I've just tried to work on this piece of legislation that will make sure that people who are in need have the kind of care that they need when an emergency happens.
Why have we done it for other public safety services? Because it's necessary. For a lot of larger municipalities that are already providing those services, it's not going to change anything for them. But I think that for these growing communities throughout the state, I think it's a necessity. I think that those are the ones that are struggling to cover their services through their smaller budgets or limited or non-existent budgets, right?
The lack of a clear mandate has led to areas in the state that are inadequately covered by EMS. It's hard to fund services and determine what a local government's responsibility is without clear requirements through legislation.
It all boils down to, can we create laws or at least some direction about how those processes should work so that there is support, so that no city or town or county can abdicate responsibility for the services that are needed for their community. Yes, they get to decide. Paiute County Commissioner Darren Bushman said, we got a game going on and not all the players are on the field. We really need to have all the players on the field.
I think there's a need for a big piece of education around what is really happening, but maybe more importantly, what's not happening.
For the County Seat, I'm Derek Dowsett.
Thanks, Derek. We will pick up our conversation with our guests, both in-house and remote, and we will return right after this commercial break on the County Seat. Welcome back to the County Seat. We are having a conversation today about emergency medical services. Joining us for our discussion in the studio is Commissioner Darren Bushman from Paiute County, who's been on the forefront of this as he is an EMS person himself. We have Mike Willits, who is the EMS director for Sevier County, the neighbor of Darren's to the north, and Representative, now Senator-elect Darren Owens. Thank you all for joining us. We appreciate your joining remotely today. Thank you. So let's just catch up a little bit. There was a lot of talk about this. There was some legislation, if I recall, that took place on this last year that set up some relief or some funding mechanism. Where have we come with that?
Last year, with the help of these two gentlemen here and your spotlighting this topic, I sponsored House Bill 389, and to provide funding, it was actually restore some funding which was cut clear back in the recession back to the emergency medical service system. And the goal was to put 5 new technicians back out in the field among rural Utah counties to help them have faster response times and to help the Bureau with funding to provide this. We had the bill accomplished, we had the funding in place, and then COVID came and took it away. But with some rallying and support from Speaker Wilson, especially Senator Okerlund and President Adams of the Senate, we were able to restore half the funding, which ended up being 1.5 million. So that's kind of where it sits, and we hope to regain the financial support we needed this next session. But it was a great success for our EMS system, and I appreciate all who were involved throughout the state.
I think when people look at this, the vast number of people that watch this are along the Wasatch Front, and they just think, well, you know, you call 911 when there's an emergency. But as we saw with the bus crash a couple of years ago down in Garfield County, that put a strain that covered most of southern and central Utah as far as EMS goes. How severe is the problem?
It's a major issue, I think, in most rural counties. There's just a dynamic that's changed in volunteerism. You know, these are primarily volunteer organizations, and volunteerism isn't what it used to be. I think people are hard-pressed to make a living. It's a double-income family scenario, and there's just not really the mentality or maybe the benefit of giving that was there before. And so you find virtually all of the entities that are trying to run these services with volunteers struggling to get volunteers.
Well, isn't it been a big enough of a problem that some counties and municipalities are just washing their hands of the whole thing and just saying, or a tendency to say, well, we're not legally required to provide this. You guys are on your own. Is that technically possible under the current scenario?
The problem with it, Chad, is it's based on licensing right now. Licensing says no area can be abandoned. The problem you have is you have cities that are covering counties, and you have counties that are covering cities. And in some cases, you don't have either. You have nonprofits that are covering, or you have private services. There's no responsibility. Nobody ultimately has the responsibility. It doesn't currently rest as a service that's mandated by law, like fire and police. And so cities don't have the responsibility and counties don't have the responsibility. And so hence nobody really ultimately has responsibility.
Mike, you've got a functioning organization. It's not like a volunteer with an ambulance parked outside near the city work shed or something. You've got a good EMS system with full-time employees. What kind of pressure does this put on you as far as responding to other communities that are less prepared?
So I kind of want to place a background here. We do have full-time and we do have volunteer part-time is in our organization. As that, and I have them spread out throughout the county. And it's interesting because, and I think what Darren was saying when the communities, in your first question, when they don't have any responsibility, we've always kind of been there on the backs of the volunteers. They've been always stepping up. And as Darren was stating, it's really difficult for them to, these days, put the time that's needed to take care of that. So I'm losing some of those people that I've relied on in the past. And as I lose those volunteers, the training has been going on for a good 10 years now plus. Being able to fill my schedule has become very difficult.
Is part of the problem because it's harder to respond? I mean, I might be oversimplifying, but you go back to any of the dramas of the 1960s, and when there's an accident or there's a problem, guys show up in white coats and a cloth stretcher, and they grab the person and throw them in the back of an old Suburban, and off they go. And that was emergency medical response. Is it more complicated, and that's part of the problem?
It is much more complicated. Our responsibilities, our scope of practice has increased over the years. The need for technologies that we have now available to us in the field, and the training that takes to keep those people.
Chad, if I could add to that, now if you are you have an accident or you're injured and you're in the bottom of a remote canyon in Zions Park, you're gonna have an EMS person respond with almost a hospital on their back, and they're probably going to leave lights on the trail on their way in, and they're going to help rescue this person, get them stabilized so that they can be taken care of and taken to medical help. But the scope of service, especially in rural Utah, has grown immensely. And to magnify all of this, with COVID, we don't have as much international travel, but tourism or recreation at least is up 200%. You try to buy a 4-seat ATV and you can't find them. And so the people have gone during lockdown or during time to quarantine, they go to rural Utah, and it's really magnified the number of people that are out in the mountains and causing some challenges for our counties and these municipalities who are helping take care of them. So.
Can I add to that? I think when we do go on those long calls, and we are up in the mountains, up on cliffs, we're down in those slot canyons, we're all over the place. We used to rely on people leaving their full-time jobs to manage this. They can be gone for 7, 8, 9 hours at times, sometimes all night long. And that really puts a strain on the businesses wanting and allowing their employees to be gone. And that adds to the confusion and concern that we have.
Well, I see two other problems that result from this as well. One of them is when you've got that canyon extraction, or you've got somebody that's got to have a lot of technical skills, take a lot of technology with them, get further away from, into the backcountry, because we can go further into the backcountry. That one takes people out of the roster for the next emergency that may happen just down the street. And it also it has a component of how do you keep everybody trained for this, because you just can't pull in a B team. Is there a continuing education requirement to all this, or should there be?
There is a continuing education, about 40, 50, and 60 hours every 2 years, depending on if you're an EMT, advanced, or a paramedic. We manage that every year. We'll go through that and recertify every other year. Initial training takes 160 hours of training for an EMT, added another 160 hours for an advanced, and then close to 1,600 to 1,800 hours in training for a paramedic. Those requirements become very, very difficult to lift when you're doing this part-time.
One last question I want to get into the atmosphere before we take a break, and that is the caseload with COVID significantly different? I mean, what has your call difference been? Initially,
when things first hit, I don't think people wanted to use anything. They stayed home, and so initially it slowed us down. Since then, it has increased, and then even more recently, we're caught up and ahead of where we were last year in our calls, and we were a banner year last year. So, which is another problem with volunteers. We're running a lot.
Mike's organization, our organization as well, we've been hit with EMTs that were exposed and were quarantined. And frankly, there's not a B team in a lot of cases, right? You just punt, you're just shorthanded. That's what it amounts to. And so we don't have depth of field in these agencies. And so as EMTs and others were sidelined, it really has caused and amplified this problem.
I'd like to redirect and talk about how we get to a solution on the problem. We're going to take a quick break. We'll be right back here on the county seat. Welcome back to the county seat. We're doing a review on emergency medical services, looking at the situation on the ground from where it moved last year. So Johnson's bill takes and places direct responsibility for somebody to have to follow up and be in charge of emergency medical services. But that still doesn't solve the problem of how you staff volunteer organizations. So, what are the solutions?
Well, in some areas, the solution is full-time employees, right? And that works on part of Mike's business. It works on part of Grand County's business, right? It works in some counties. Paiute, Garfield, Beaver, it probably doesn't work because there'd be a whole lot of solitaire time, right? And the minute that you'd have one call, you'd have 2 or 3. And so even if you did have full-time staff, they wouldn't be able to handle it because you got to have depth of field, right?
Well, so, and that's one of the things that an urbanized area has is that when Midvale City gets too busy, Cottonwood Heights can come in and help cover them. But you're adding hours of time to ask the next county to come help.
We think there's a silver bullet. We also think it's a huge lift. But the one thing that people look for in rural Utah is health insurance. And somehow we've got to provide an incentive for people to want to be away from their families in the middle of the night, to get up from Thanksgiving dinner and go on an ambulance run. Somehow there's got to be an incentive. We believe health insurance is a potential way to do that for first responders. It's a huge lift. It's a lift that counties can't fund by themselves. It's not. There's not the money in the service, in billing or otherwise, to provide that because the service is built around EMT staffs that are volunteer primarily.
So looking at that from a legislative perspective, Darren, if you had to make a choice when you were doing funding of trying to put enough full-time staff spread out throughout the state to help cover districts back and forth versus paying for health insurance, does it make economic sense? Is this a viable option? Because I don't see many others.
I think it's probably, we've come to this over a lot of discussion and attention to it. I think it's a viable option. When you have the coverage that the urban our neighbors have, then that's great. We just want to provide that same coverage for everyone who's in rural Utah. We love our urban neighbors and want them to come and visit. They keep our businesses open. When they're here, we need to be able to make sure we have EMS coverage for them.
And you think from your end that if your volunteer rosters would grow if people could get health insurance? I mean, I figured everybody had it anyway. I don't know.
I think there's a gap that could be filled there with that insurance. I'm always told I really don't do this for the money, but boy, those incentives where it provides and helps for the family, I think it would be a huge benefit for my EMTs.
Yeah, I agree. I don't think any of us do it for the money. The money's not substantial. It is kind of a nice pat on the back when you do get that check that has a few runs on it, and we get paid a few bucks to go out. But I think ultimately there's a large number of people that don't have health insurance. And surprisingly, there are people that want to volunteer and have the time to volunteer. This would be an incentive for them to step forward. as Mike said earlier, it's a huge commitment to become an EMT. It's a huge commitment to stay certified as an EMT, not to mention just the run times and you know, a lot of your own travel and all of these things that go along with it. You know, some counties don't even pay for the certification process because their budgets are so tight, they can't even pay to educate new EMTs. The EMTs have to pay for it themselves, and you don't recover that. There's not really enough pat on the back to even recover that you spend on certifying as an EMT or an advanced EMT.
Excellent. We're going to take a quick break here. We'll come back for final thoughts. You're watching the County Seat, talking about the problems of rural emergency medical service. Welcome back to the County Seat. We are talking today about EMS and the problem in rural Utah. Last thoughts, Darren Owens, you go first.
Sure, thank you. This is a complicated challenge, and we're going to find a solution and help these rural counties. So we appreciate the attention. Just give you a scenario of an unfunded care that sometimes is received. If there's an accident out on a cliff, as Mike was talking about earlier, in the canyon, and life flight is called in, the rural county EMS folks will go in and stabilize the individual. They'll bring them out, have them wrapped and ready to go. And when they fly away on life flight, there's no billing to the counties. That's just unfunded care that was given. And that happens. And it might take 7-8 hours on this call, or they get little to no compensation for that. So we'll keep working at it and find a solution that helps the counties.
Yeah, I agree with Representative Owens. There's a lot of services that are provided by counties that aren't funded in any way. There's no billing for them. There's also situations where they're Medicare, Medicaid billing, where literally the agency gets paid 10 cents on the dollar. So, you know, it's tough.
And you got to realize that the ones that are paying for that community service to be available 24/7, 365. And so that funding is not coming elsewhere.
The funding really needs to be spread, Chad, not only amongst the local citizens that are paying taxes in their community, but it also needs to be spread on those who are visiting the communities, right? So there's kind of a twofold problem. That's why we've looked at trying to get a permanent funding source, maybe through restaurant tax or transient room tax or other mechanisms, because this is a pretty big challenge and it's going to take money to solve it. You know, this health insurance discussion is no small amount of money we're talking about. So somehow we have to get a funding model that continues to support the efforts of capital equipment as well as the ongoing operations of these entities.
Okay, wow, very complicated issue, a lot of moving parts. Thank you for being so engaged in this system. You guys are great servants to not only your communities, but to the state. And we'll see you next week on the County Seat. Thank you for watching the County Seat. Be sure to subscribe and turn on your notifications to keep up to date on the program and happenings around Utah.